I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Have you ever suffered sinus infection? It can interfere with both taste and smell. What can you do about it? This is the People's for weeks and make people feel miserable. It's not just the congestion, headache, and pressure. Some people develop troublesome postnasal drip.
What treatments work? When should someone consider surgery?
Coming up on the People's Pharmacy, how to stop suffering from sinusitis.
In the People's Pharmacy Health Headlines, older individuals who feel that they have a purpose in life are less likely to develop cognitive impairment. The data comes from the Health and Retirement Study with more than 13,000 volunteers over 45 years old. They all had normal cognitive function at the beginning of the study and responded to a validated 7-item survey to measure purpose in life. Over the course of the 15-year study, 13% of the participants developed cognitive impairment. Those who scored higher on the purpose in life measure were 28% less likely to become impaired. Purpose can vary. For some people, it consists of spirituality or faith, while for others it may be linked to work, volunteering, or helping others. Relationships with family or close friends can also provide a sense of purpose. One of the investigators notes, it's never too early or too late to start thinking about what gives your life meaning.
Many chronic health conditions begin long before symptoms appear. The thickening of arteries leading to heart disease can develop many years before someone has a heart attack. Neurodegenerative conditions such as Alzheimer's disease also create changes in the brain long before people notice cognitive impairment. Now, scientists have found early indications of rheumatoid arthritis. 3 to 5 years before people experience swollen and painful joints, they begin developing elevated levels of autoantibodies. The authors of the study suggest that preemptive intervention in at-risk individuals might prevent or delay future tissue damage from rheumatoid arthritis.
Researchers reported new approach to treating knee osteoarthritis can ease pain. Korean scientists compared low-dose radiation to sham treatment. This is a type of treatment that's already being used in Europe, but studies of low-dose radiation are scarce. In this one, investigators recruited 114 people with knee osteoarthritis and randomly assigned them to one of 3 groups. Low-dose radiation of 3 gray, very low dose of 0.3 gray, or sham radiation. All groups received 6 sessions. 4 months later, volunteers rated their pain. 70% of the patients in the group that received 3 gray got significant pain relief. Almost 60% of them had improvements in stiffness and physical function as well. 58% of the very low-dose group got results. That was not significantly better than the placebo group at 42%. The researchers hope this could help people delay joint replacement. There were no serious side effects from the low-dose radiation.
A surprisingly large number of Americans suffer chronic pain. In 2010, the most prescribed drug in America was an opioid called hydrocodone. Some of those prescriptions were inappropriate, but clearly a lot of citizens were in severe pain. Opioid prescriptions have dropped dramatically over the last 15 years. Today, the most frequently prescribed medicine for pain is gabapentin. An article in the Annals of Internal Medicine describes the rapid increase in gabapentin prescriptions. Last year, it was the number 5 most prescribed medicine in America. In 2010, 5.8 million people were taking gabapentin. Last year, that number had jumped to 15.5 million. Most of the prescriptions were off-label. That's because gabapentin has only been approved for treating partial seizures and the lingering pain after a shingles episode. A downside to relying on gabapentin, especially for older people, is that it may increase the risk for falls. Side effects such as dizziness, drowsiness, and trouble walking elevate that danger.
Doctors have begun to worry about the long-term risks of sleeping pills, so they are looking for alternatives. A new meta-analysis of 67 randomized clinical trials shows that a technique
Please
called
subscribe, share, like, and comment. And you can write me a comment with any medical-related pharmacy question, and I will answer you back.
Effects. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Have you ever suffered from sinusitis? If not, you're fortunate. The CDC says that almost 30 million Americans have been diagnosed with this condition. That's over 11% of the population.
How would you know if a sinus infection were causing your symptoms? Could your stuffy nose and head pain be allergies or a cold instead of sinusitis?
To learn more about sinuses and the trouble they can cause, we're talking with Dr. Zara Patel. She's professor and director of endoscopic skull-base surgery at Stanford School of Medicine. She's also director of the Neurorhinology Advanced Sinus and Skull-Base Surgery Fellowship in the Department of Otolaryngology, Head and Neck Surgery at Stanford. Dr. Patel is also director of the Stanford Initiative to Cure Smell and Taste Loss, something more important now than ever before thanks to COVID.
Welcome back to the People's Pharmacy, Dr. Zara Patel.
Hi there. Thank you so much for having me again.
Well, we're delighted to be able to talk to you about something that affects millions and millions of people. Sinuses. What are they? Where are they? And after you've given us a little anatomy lesson, we'll ask you what they do. So first of all, what and where?
Sure. So the sinuses, what we also call the paranasal sinuses, are these pockets of air-filled cavities that are basically in the face. And the reason we have them has been debated, but what they do is they pneumatize or create air spaces in the head. And what that does is it creates a potential crumple zone if your head ever had trauma that could absorb the impact of that trauma before your brain gets hit with that trauma. That's a lot of people's theory as to why we have these air-filled spaces around our nose and in our facial skeleton. There's also other theories as to why we have them, which have more to do with other sort of evolutionary theories, such as it makes our heads lighter, and that may have been a crucial component in what allowed us to start standing up and walking as a way of getting around. And finally, there's some theory that the sinuses lend more resonance to our voices, and that led to improved and more complex communication between human beings. So all different evolutionary theories as to why we have these sinuses. Now, the final theory is maybe the most important, and probably we'll talk a lot about today, and that is there is a local immune system in the lining of your nose and sinuses that is a crucial component of your overall systemic immune system, and that is one of the first leading defenses of keeping your body healthy when you breathe in any sort of potential irritants or allergens or toxins in the air.
Dr. Patel, pretend that I'm really, really dumb. And I think sometimes Terry would attest to the fact that that's probably true. But when it comes to the anatomy of these sinuses, first of all, how many are there? And where precisely? You say around the nose, the face. I assume they sort of protrude up into the brain, but can you give us a little bit more of an anatomy lesson?
Sure. So if you were to look at the face, beneath the surface of the skin are muscles and bones. And beneath those bones are the air-filled pockets. So you have the frontal sinuses, which are in your forehead region. You have the ethmoid sinuses, which is a little honeycomb of little cells and septations, so multiple cells, but we call them one group of cells, the ethmoid sinus. And the maxillary sinuses, which are in your eyes and on the sides of your nose. And the deepest point, which is kind of located right in the center of your head, are the sphenoid sinuses, the deepest sinuses. And these sinuses are most of the time paired, although there is some anatomic variation where some people won't develop frontal sinuses or just develop one. But most of the time, people have, bilateral, meaning on both sides of their head, these paired sinuses. And they all open and drain into the nasal cavity. And that is how they aerate also, with air coming through the nasal cavity. And I make a point to make sure you understand that they're not directly under the skin. There is that layer of muscle and bone, because sometimes people will say, oh, I'm swollen. They touch their face underneath their eyes or on their cheeks, and they say, oh, my sinuses, I'm swollen. That's not your sinuses. What you're feeling in that sort of moment is the soft tissue of the skin and subcutaneous tissue itself, which can swell due to things like allergy, but that is not directly from your sinuses. Only when a sinus infection gets really, really bad and actually can break through the bone, that's the only time that you would have a swelling related to sinusitis, and that's very, very rare, and you would know that you're having a major problem at that point.
It definitely sounds terrible.
So, Dr. Patel, you are a professor of otolaryngology and head and neck surgery, and that means that you have performed surgery on a lot of people's sinuses. I'm guessing that anyway. And I have a good friend who says he has giganto sinuses and gets terrible, just unbearable sinus infections and sinusitis, and we'll get into all that in a minute. But you've probably seen a lot of variability in the size of people's sinuses, or am I making that up?
Yeah, so, I think when people say they have giant sinuses, that may be because they have actually seen a CT scan of their own. Although there is some size, that's not the thing that varies most. The sort of complex pattern of cellular septations and drainage paths, that's where the variability comes most. So the size is not that variable, but the complexity of the pattern of drainage and pneumatization in the face of that bone, that is very individualized. And yeah, I'm a professor of otolaryngology, head and neck surgery, but even more specifically of rhinology, which is, the subspecialty of just the nose, sinuses, and skull base above, that bone that separates the sinuses from the brain. And so I have
Itis on the end of a word. We're talking about inflammation. So is that true for sinusitis?
Yes, that's exactly right. So sinusitis, or what we sometimes call more specifically rhinosinusitis, which includes the nose in that inflammation, is really this end state of mucosal inflammation within those sinus cavities and often the nasal cavity.